and thank you all for being here today. Let me get right to the point. Congress should repeal the sequester. It was never meant to happen. It was meant to be an incentive to force Congress to find a way to reduce the deficit. Because no one certainly would be so uncompromising and so irresponsible as to let the sequester happen, right? Well, they were wrong about that. According to the Office of Management and Budget, that issued a report just yesterday, let me quote them, "It is not the responsible way for our nation to achieve deficit reduction. These proposals would shift the burden of deficit reduction onto the middle class and vulnerable populations and represent the wrong choices for the nation's long-term growth and prosperity. Sequestration would undermine investments vital to economic growth, threaten the safety and security of the American people, and cause severe harm to programs that benefit the middle class, seniors, and children." That's the end of the quote. Even though we've passed March 1st, which was the supposed implementation date of the sequester, Congress still has time to act before these indiscriminate and irresponsible cuts can actually take effect. Neither should we replace the sequester. We want it repealed. The sequester, along with the fiscal cliff and the debt ceiling and any other self-made fiscal crisis, is being used as leverage to attack long-standing programs like Social Security, Medicare, and Medicaid. Social Security didn't cause the deficit and shouldn't be used to fix it. The chain CPI would hurt seniors the most who are already living on the edge. And we've done some interviews locally with seniors who are in that position. They can't afford to have any more cuts. There are better ways to cut the costs in Medicare than raising the age or just simply shifting the cost to seniors, employers, or the state, as would happen under the Ryan plan with his budget. Now, the sequester itself does not directly affect benefits for Social Security and Medicare, but it does affect a lot of programs that seniors rely on. And I've checked with some agencies. At this point, they don't know the details of how these cuts will affect them, but according to National ARA, these are the potential cuts that could happen under sequestration. First, under Social Security services. The Social Security Administration would be forced to curtail service to the public and reduce program oversight efforts designed to make sure benefits are paid accurately and to the right people. Potential effects on Social Security operations could include a reduction in service hours to the public and substantial growth in the backlog of Social Security disability claims. Another area where there would be a great effect is senior meals. Federally assisted programs like Meals on Wheels would be able to serve 4 million fewer meals to seniors. This is nationally. These meals contribute to the overall health and well-being of participating seniors, including those with chronic illnesses that are affected by diet, such as diabetes and heart disease, and frail seniors who are homebound. The meals can account for 50% or more of daily food for the majority of participants. Iowa would lose approximately $220,000 in funds that provide meals for seniors. Here are some other things that could be affected by the sequester. Nearly 2 million senior transportation rides lost. 1.5 million seniors denied personal care services. Almost 485,000 seniors losing access to health promotion and disease prevention. 290,000 senior households denied LIHEAP energy assistance. 114,000 senior households received reduced maintenance and support services. And 2.2 million fewer community service hours at a value of nearly $50 million, including at least a $17.5 million cut in wages and benefits for low-income older workers. Now, as you can see, many of the effects have to do with jobs. It will cause hundreds of thousands of jobs to be lost across this country. And the last thing we need right now, while the economy is still struggling to full recovery, is a loss of jobs. The answer to this is jobs and reducing the costs of health care. That's the real solution to the deficit problem, not the sequester. Thank you.